I am presenting the paper titled Depressive Disorders Among People Living with HIV/AIDS. Depression is commonly associated with a variety of chronic medical illnesses like diabetes mellitus, hypertension and malignancy. And depression was also being associated with HIV infection from the very beginning of its epidemic. And HIV infection initiates a long and complicated emotional process, often with moments of despair, denial and personal loss and sadness. And among patients with HIV infection, depressive disorder is the most frequently observed psychiatric condition. And it results in significant loss of function and a marked diminution in the quality of life. And only few studies have been published from India regarding depression and HIV, and no studies have been published from Kerala. And the prevalence of major depressive disorder in HIV infection was found to be significantly higher compared to general population in various earlier studies as projected here. About aims and objectives, the main aim of the study was to get an estimate of the rate of depressive disorder in people living with HIV/AIDS. And the additional aims was to assess the socio-demographic profile of people living with HIV/AIDS, to compare the prevalence of depressive disorder in HIV positive persons with those who are HIV negative, and to investigate the factors associated with depression. Materials and methods, sample selection. Persons seeking help from Jyoti Center, that is Integrated Counseling and Testing Center, attached to the Department of Microbiology in a tertiary care center in Kerala from April 2007 to May 2008, who are found to be HIV positive, were taken as test subjects. And the study was approved by the Institutional Review Board, and the inclusion criteria were persons tested to be HIV positive with 3 different ELISA tests, age group 20 to 60 years, subjects who provided written informed consent, age and sex comparable HIV negative individuals as the control subjects. Exclusion criteria: subjects with any significant neurological disease including traumatic brain injury, subjects with any other significant chronic medical illnesses, subjects with a past history or family history of any major psychiatric disorder, and subjects with active use of alcohol and other substances. The materials I used were a personal pro forma with written informed consent, Kuppusamy scale, general health questionnaire, diagnostic criteria for research as per IC written, a 17-item Hamilton Depression Rating Scale, and a modified 11-item Hamilton Depression Rating Scale in order to eliminate the physical symptoms which might overlap with the symptoms of HIV disease. Results: a total of 3,157 individuals attended the clinic during the study period. Males were 50.8%, females were 42.8%, and children were 6.4%. Out of this, 5.5% of individuals were tested to be HIV positive. Comprised males was 49.4%, females were 44.3%, and children were 6.3%. Out of this, 33.1%, that is 54 individuals, satisfied both inclusion and exclusion criteria and were taken into the study. And the mean age of the population was 38.9 plus or minus 7.8 years. And regarding the socio-demographic profile, with respect to religion, the marital status, the socio-economic status, and the family type, there was not much significant difference between the test population and the control population. And regarding the prevalence of depression, in the study population, in the test population, it was found that 61.1% of individuals satisfy the criteria for depressive episode. And in control population, only 13% satisfy the criteria for depressive episode. And on applying Pearson's chi-square test, the significance was found to be high, that is p-value was less than 0.0001. And regarding the sex distribution, of people living with HIV/AIDS, 58.1% of the males satisfied the criteria for depression, and 65.2% of females satisfied the criteria for depression. And on assessing the values or results of various scores of GHQ-12, Hamilton Depression Rating Scale 17 and Hamilton Depression Rating Scale 11, there was a significant difference. And on assessing the ranks of the scores of GHQ-12, Hamilton, HAM-D 17 and HAM-D 11, using the Mann-Whitney and Wilcoxon W test, the difference was found to be highly significant, p-value less than 0.0001. Discussion. In the current study, significant difference in the prevalence of depressive disorders among people living with HIV/AIDS and HIV-negative individuals are found. And there is significant difference in the scores of GHQ-12, HAM-D 17 and HAM-D 11. This study also corroborates the earlier studies that HIV infection is a risk factor for development of depression. The NGOs, the counselors and the physicians working with the people living with HIV/AIDS should be given adequate psychiatric training to identify the symptoms of depression and for the timely referral of the patients. The limitations of the study: only 33.1% of the people living with HIV/AIDS were included in the study, which would have given rise to a sample bias. And the current study only looked into the depressive disorders in people living with HIV/AIDS, and other psychiatric disorders like anxiety disorders, psychosis and cognitive impairment are also common in this group. And the disease stage, the antiretroviral treatment status and the cognitive impairment were not considered in the study. Conclusion: the rate of depressive disorders is high among people living with HIV/AIDS compared to HIV-negative individuals, and the ranks of scores of GHQ-12, HAM-D 17 and HAM-D 11 are high among PLWHA compared to HIV-negative individuals. And these are my main references. And finally, I take this opportunity to extend my heartfelt thanks to the head of the departments of microbiology and psychiatry and all the colleagues and faculty members of both departments in helping me to complete this study. And I extend my sincere gratitude towards the organizers for giving me the opportunity to present my paper. And thank you all for your patient hearing. Thank you.
Thank you, Dr. J. Mon. Paper is open for discussion, comments, queries.